The head nurses are the backbone of the health system. They're the first contact, and they're the people who will be there throughout, from birth until the person is older. Even in the times of the COVID, when the specialist comes, we'll be able to assess the patient and do whatever, and then leave the patient with the nurse. So it's the nurse who sits with the patient throughout the whole time. And yet, you'll find that the nurses are also the ones that work longer shifts. That's why we always say that we are the ones at the cold face, but we find that they are the ones who end up being left behind when it comes to the issues of the incentives. General, as you know, that we are the lowest paid categories among the health professionals, and yet we work more than 2 hours. So today, we are here to commemorate and also to honor the nurses. And because nursing originated from Florence Nightingale, always this day, we always remind ourselves of the nurses' pledge, why we chose nursing. I am a nurse, by the way. So that's why the director of nursing will lead us with the nurses' pledge. It's about remembering why did we choose, because we fight when no more else can be able to fight. We are the ones who care even when nobody cares even for us. When even nobody cares even for you, but we'll be the ones who cares. We're the ones who have to break the news that your child is not well or your mother has died. Because we are the ones, usually the last person you have to close your mother's, your father's eyes. We are the ones mostly who bring the babies, the midwives bring the babies, and we are the ones actually who dresses, we call them last offices, the last patient in terms of the last breath. So in these times, difficult times of the COVID, we can understand the frustration. We can understand when some of them find that they are even asking themselves why they should be even at work, when you know that you bring the virus even back home. Because we ask ourselves, we have seen even internationally where we find that some nurses, pregnant or not, they're still on the cold face, and yet they've been exposed. So we want to honor those. With those words, I think the HOD and then Dr. Mabud, if you could say something. Are you still not on yet? Okay.
Thank you very much, everyone, and thank you for being here. It's a great privilege and an honor for me to be here at International Nurses Day and the Year of the Nurse. I had the privilege of speaking to a nurse 3 days ago, and I was struck how remarkable it is. I asked her only 3 questions. The first question I asked her is, why did you become a nurse? And without hesitation, what she told me, she wanted to help and serve her people. Without any question. When I asked her, what is it like to be a nurse in 2020, in the Year of the Nurse, she said to me, she wouldn't have imagined how anxious and how afraid she would be. And all the anxiety and the fear that COVID has placed in people. So I said to her, with all that fear, what is your biggest fear? And she said her biggest fear is going back home and taking COVID to her family, to her loved ones. And then I asked her, with all that fear and what you do, and she told me in brilliant ways how everybody in her house knows about COVID, how everybody knows what to do to protect themselves. And I asked her, now, why do you keep on coming back to work? And she had the smile on her face, which just says, that is what I have to do. I have to serve the people. I have to do because that's what I'm committed to. In that moment, it encapsulates the bravery, the incredible commitment that people that embark on the cause of noble cause of being a nurse comes to life. In what we're facing in South Africa now with COVID, that's the bravery that we have to recognize today. It's people that are fearful, that are anxious, that are human, but they still go and they serve. Because they bring in that moment of solace to people that's less fortunate than them. They bring solace. And that is what we salute. I salute all the nurses in the Western Cape. I salute all the nurses in South Africa. And I salute the brave people that's standing here behind us. Thank you very much.
Thank you, MEC. Thank you, our HOD. Thank you, nurse managers, Ms. Franceline Hartmut, the nurse manager of Tigerberg, in particular, colleagues, ladies and gentlemen, and the media. Being the director of nursing at this particular moment is quite a very difficult task, more especially because we are in a year where we were supposed to be celebrating. As the minister have said, 2020 was declared as a year of the nurse and midwives by the World Health Assembly, which meant that it was supposed to be a year where we should be celebrating and saying, well done to our nurses. None of us has ever envisaged that in the year 2020, instead of celebrating the good work which the nurses do, the sacrifices which the nurses give to their work, we will be standing here instead being confronted with this pandemic, being confronted with the coronavirus, which above all, it requires the nurses to be there so that we can save our communities. Like the HOD have said, the fear and anxiety which is there is real, because these nurses are part of the communities. These nurses, their mothers, fathers, sons and daughters, after work, after every shift, they have to go back home and face the family members who are also anxious, not knowing what to expect next. But we want to say on this day, we salute all our nurses and midwives who are courageous, who are always there for the patient and living up to their pledge. Later on in the program, we are going to recite the pledge so that you understand the commitment that comes with being a nurse, being a midwife. But we are saying, as a province, to our nurses as frontline soldiers, this battle, we can only win it with all the efforts of our nurses and midwives on the ground. Because these are nurses who are there before conception and they are there during last office. Maybe I must expand on that statement. Nurses are there during family planning. They are the ones who will advise the families to say that these are your family planning method that you can take. They are there after conception when the baby has been conceived. They are there as midwives during antenatal, during delivery, and of course during the all phases or stages of the child as the child grows to adulthood, be it being a school health nurse or being a nurse working in variety of specialties. Because, ladies and gentlemen, it's only nurses who are there 24/7. It's only nurses who understand the patients from the day he walks into the door of the hospital to the day he leaves the hospital, either leaving the hospital living or leaving the hospital in a casket. But the nurse will be there every minute, every second. That's why the World Health Organization deemed it fit to say that this year should be declared the year of nurses and midwives, because for the world governments to achieve access to health care, to achieve universal health coverage, there should be nurses on the ground.